Get 1,000 likes on this video. Jace will treat everybody's glute. Everyone will get a fair go at it, and we'll see who performs, who feels better, how their back feels, how their hips, how their hammies feel afterwards, all right? So, hey guys, Darcy here, co-owner of MMT. I've treated tons of this muscle. I'm treating it every single day to relieve lower back pain, hip pain, and just overall function in the mid part of your body. That muscle, those muscles, Jason's glute. We're gonna do a full comprehensive treatment, Jace, of your glute. We're gonna use our pisiforms, thumbs, elbows, and showcase how we get relief and more range of motion in somebody's glute.
Wow, you thought long and hard about this one, Darcy.
Yeah, mate, so what we're doing is I'm gonna use my pisiform.
But before you start, Darcy,
Yeah.
I reckon if we can get 1,000 likes on this video, I'll treat Darcy's glute next week.
Yeah,
How about that?
Yeah, let's do it. 1,000 likes, guys. We're not asking for too much. So, Jace, let's get the bum out. Sorry, mate. The towel was in the way. Waxing up. And what I'm doing is I'm going to focus on connecting to the pisiform.
Just so I...
Yeah, sorry, mate.
No, just in case the old YouTube people don't...
ban us. Yep. Connecting
This is educational. Let's go, Darcy. How you fixing my glute?
Yeah. So, let's get back to being serious. Comprehensive glute treatment. So I'm going to focus on glute max, med, minimus.
Minimum?
Oh, it's the minimum of all the glutes. It's the smallest.
It's still very important.
Still very important. But just like doing a really thorough job. There is some seriousness to this. You know, doing a lot of leg weights, running, performance, having glutes that aren't overactive, tight and angry is going to relieve pain in your lower back. You are going to feel more functional when running and moving laterally. You're going to perform better in your sport. There is a lot of nerves that run through here that can be causing some or inhibiting how your hamstrings function, how your calves function. So doing a really thorough job of tracing the ilium, working into the sacrum, and working on the origins of where these muscles start and insert into.
Oh, it's good. Yeah, a lot of the times it can be even like if you've got constantly tight calves, maybe your glutes are weak, so you might actually treat the glute to release some tension if they're not actually able to lengthen and contract. So, yeah, definitely function, but even if you're not necessarily an athlete, if you're sitting down all day, that could be contributing to some back pain, as Darcy said, or even if you're, that's pointy there. Jeez. Oh, he's gone real pointy. I'll shut up now.
Look at that twitching. So Jace is probably not as relaxed as what we'd like. So I need to ease up. You can see the twitching.
Straight.
The reason we treat Jason's glutes is because he is strong as hell in his glutes. He's lifting over 220 kilos with his deadlifts. A lot of that's coming from his ass. So getting into here and actually loosening up. He did deadlifts last night, squats, the lunges, functional training, circuits. His glutes are getting fatigued and tight and sore. Overactive glutes is going to limit flexion. So if you're, we think of our glute as an extensor of the hip. If you can't flex the hip, if you can't bring your knee up to your chest, if you can't stretch it that way, you're not getting full function. Therefore, your performance when you're running, jumping, playing your sport, basketball, footy, tennis, whatever it might be, you're actually not, you're limited to performing at your most potential, your highest reach. So loosening this off is actually going to allow, yes, the engagement, so that neuromuscular connection to be more fluent and activate more purely, and also, the restriction of flexion that we're going to gauge, as it's an antagonist of our hip flexors and quads and groins, the hip flexors. So a lot of the time, glutes are underactive, dormant, weak. We see anterior pelvic tilts, we see shifts in the pelvis, and people become really dormant and weak. That's the opposite with Jace. Jace is more overactive, overworking in a sense. But yeah, the more you sit on your ass, the ability to contract it, to use it, actually becomes less. So focusing on working these spots on Jace is more about releasing what's tight, so he actually has more function, less pain, his back feels better, his hamstrings contract better, and he gets more flexibility.
Feels good.
Feels good?
Yeah.
That's your hook there.
Bloody good, wasn't it?
Bloody good, mate.
Oh.
Hook in.
Hook in.
Beautiful. So that's tracing all the glutes from the sacrum down. Next one, I'm going to actually use my left. I'm going to go down like this. SI joint pain, irritation. We fix it with this stroke here.
Oh, jeez. It's good.
It's good. Calm it down. I'm going to treat one glute one way, and if you stick around, I'll treat the other side, and I'll use some different techniques, showing you with hands and thumbs, palms, how we can still be effective and efficient, collecting all the build-up and tension, but just using different techniques. And you've got to have different techniques.
Different toolkit for different presentations. And different body shapes and sizes.
Yep. Some people are a lot smaller. The elbows are going to be too much. So tracing that, working through the nerves that come out of that sacrum. So I'll show you here, Leo, what we're doing. You can see the nerves. I'm tracing that sacroiliac joint that can become really compressed, and then these nerves that run out of there can have adhesions on them, compressing them to the bone, causing numbness or tingling. And that, we see a lot of that. And that stroke there is healing it. So now we're going to go a little bit wider, tracing the bowl. There we go. Beautiful. I can feel under my elbow there's so much tension here, sort of contracting and...
Trying to relax it.
No, you're doing well. That's why we thought we'd have some fun with Jason's glutes. He does find it hard to completely relax just because of that tension, that chronic activity through here. Our glutes should be our primary movers. They're the powerhouse of our body. Keep strengthening them, but at the same time, make sure you're on the foam roller, make sure you're booking in, getting some good treatment on it. Okay, next thing I'm going to do is use my thumb and come over and treat glute med.
Oh.
Yeah, right there. And you can see, look, come out of it, relax that glute, Jace. Nice. Come in slow. I'm going to go really slow. He's not going to activate it. He's not going to fight me. There we go.
Oh, little one.
Little twitch.
That's all right.
That's all right. Beautiful. Nice. So pinning that glute med, I can feel that there's a fibrotic component, like a really tight band in there. And that's what I want to get into. Loosen that off. Beautiful. Nice. Pin that. And then trace it down and around. So the thumbs are definitely a tool that have the more sensitivity. I can really have a really good feel of what's going on. My elbows are definitely, over the years, I have a good feel and know my groove and know my skill set is really good. But my thumb, I can really get a good insight as to where those little adhesions are, where things have become stagnant.
A bit more pinpoint with the thumbs.
More pinpoint too, which can be a good thing, but it also can be too much sometimes for the client to process, receive. So work that. Now I'm on that greater trochanter into that insertion. I'll show you with an elbow there as well. I really like using an elbow in that spot just to get broad,
it's good.
Hit more surface area. Nice. Beautiful. Yeah, Jason, the walnut ass. I reckon you could crack a walnut in there. Can we crack his walnut?
Nah.
Oh. By far the most treated glute on the internet.
I reckon it'd be up there, wouldn't it? Between yours and mine.
Yeah. How many times can Jason's glute be treated, and how many different ways can it be treated?
We might have to go back and do a count. What do you reckon?
Yeah.
Who's got the most?
Yeah.
Give it comment, guys. Who do you reckon's had the most glute treatment out of the MMT crew? Darcy, myself, Aaron, Ninja.
Yeah. And yeah, we want to know, guys, is give us some likes. As I said, as Jason said at the start of the video, get 1,000 likes on this video. Jace will treat everybody's glute. Everyone will get a fair go at it, and we'll see who performs, who feels better, how their back feels, how their hips, how their hammies feel afterwards, all right? So, start liking. Get this.
Share it to your mates.
Share it. Like, subscribe. That helps us, guys, and we appreciate it.
Yeah, we want to help as many people get out of pain as possible. So that's the real work that we're doing day to day, getting everyday humans and athletes out of pain. So that's our bigger reason behind doing this content. And, we want it to be entertaining, but at the end of the day, we're trying to spread our work that we do, and that's what we're doing with our coursework, that training up practitioners that are better able to treat with our methodology and get good results. So at the end of the day, that's the real work we're doing in the world. So we want to inspire other people to be fitter, stronger, healthier, pain-free, and live your best life. So if that starts with one glute video, then that's the way we're getting it out there.
Yep. Good spiel, Jace.
Oh, there you go. That's a bit more. Oh, the walnut's
all right,
back.
just for the sake of this last side,
jeez.
we're going to get.
Oh, the walnut.
We're going to hook in. We're going to see, just for the sake of this video, if Chase can get 100% into his glute. Look at him tensing up. Ready and go.
Second.
We're having too much fun. We won't do that. All right, guys, that's the right side. I'm going to show you the left.
Oh, what do we got for the left?
For the left, something different.
Oh, no.
The knee. How we treat it with... No, I'm joking. I'm being serious here. So we started with the nerves, the sacrum. If there was some compression through there, if that joint wasn't moving that well and it felt quite blocked, stuck, or glued. Now we're going to focus on the actual fibers and the tissues of the glute. And you can see over here, Leo, the tracing these glute fibers here, the glute max, glute med and glute min. So I'm going to trace the fibers of the glute in a direction that is just going to open up channels for blood flow and circulation. So I'm here, still focusing on the attachments. It's making sure I'm connected in with that bone, but working on the same side. And then pinning, working back into that, and then out. And we might be able to see in about another 10 minutes which glute feels better by treating it differently. How many ways can you skin a cat, you know? That's the thought process. You ever skinned a cat, Jason?
No, I haven't actually. I was thinking that. How many ways are there?
Nah, I wouldn't want to do it.
Nah. Oh, we'll stick to treating glutes.
Yeah. How many ways can you treat a glute? We'll just leave it at that. So just some broad strokes, getting as much of that surface as I can.
Nice, Gary.
Nice, Gary. Beautiful. Here we go. Straight down the guts. Through there.
Oh, feeling pretty good there.
Feeling pretty good, pretty clean. He's liking the palms. All right, now I'm going to use the angle of this hook in.
Oh, a bit more
use
there.
that wall.
Oh, that's got a lot already.
There we go. And again, now I'm hitting his the outside of the hip, greater trochanter, tracing glute min. Yeah, and then I'm going to turn that into a stroke that feels like it just goes forever. It's about being therapeutic here. I'm not torturing him. just yet.
Oh.
But yeah, guys, we are teaching this. If you are somebody that's not getting results, you want to upskill, you want to take your treatment techniques to another level, we do have a course. Click the link below, learn our stuff. Become a certified MMT practitioner. You'll be a body worker in no time, getting 5-star reviews, returning clients, fixing people's glutes. Jason's got some curry there.
Oh.
When I find a spot like that, I just want to camp on it, sit there, melt it.
Oh.
And at the start, as much as the client can be, wanting you to move through it, they're going to thank you for it when you are more thorough, melting away that point. That's the source of, some dysfunction. It might be a really tight band that's limiting that flexion. It might be a really tight band that's limiting external rotation in the hip. I'm pretty deep there. And yeah, go deep, go slow, do a thorough job. Nice. Beautiful. Really, really slow. I'm just applying pressure in the tissue, the direction of the fibers. That's just letting me glide through there without actually any pull towards myself. See some twitching going on, Leo, at the top of the glute. Cool, we're unraveling that tendon. Nice. That's what we want. Sink out of that. All right, now I'm going to use some thumbs like this. Double thumb. Come over here, Leo, I'll show you. Bit of wax. We thumb there. Pin, go deep. Jason's staying nice and relaxed. And then I'm tracing the ilium, tracing that hip on the lateral aspect. Now the glute has so many attachment on this area. Hitting the tendons, that's what we want to do, be effective at hitting the tendons. There's a good little nugget.
Yep. Oh, certainly. Oh.
Find the nuggets. Speaking of nuggets, you seen those videos on bloody Facebook on how they make chicken nuggets?
No, I don't want to know.
So bad.
Like hot dogs, where it's just disgusting.
Fuck. Looks like rubber.
A good thing for me, I haven't eaten a chicken nugget in I don't know how many years, so that's one thing that I've never really.
Nah, some people love it, eh?
Yeah, I've never really had a massive pull to chicken nuggets. So
remember the days you'd get a Happy Meal and it's like, do you want the cheeseburger? Do you want the nuggets? I never got it why people wanted the nuggets.
No, fuck that. Get the burger.
Felt like you got less.
Yeah, absolutely. Unless you get a whole box full of nuggets, but yeah, I wouldn't be doing that these days, knowing what we know about the food.
Yeah, nah. Even ordering the chicken from the supermarket, like they're like 8-week-old chickens. They've just been puffed up, full of steroids and
stuff,
hormones to make them grow. Their feed of, imagine that. Imagine
buff chickens walking around.
Yeah, and chucked in a bloody plastic bag for you to eat. Anyway, guys, we've got off topic.
No,
It's not
good.
food. All right, Knuckles. Get your knuckles into his glute. He wants to do some external rotation up and tell. That's a nice little active release. And then... Okay. Look at that. Just gets deep as in there. All right, I'm going to do that for him. So, pin, hold, a little bit of twitching. And then we're going to externally rotate, internally rotate. Yeah. Sharpen that elbow.
Oh, really?
Go deep. Yep.
Oh.
Struggling to cross your hips. Jace has trouble with that. Probably got really tight glutes.
Me? Nah, never.
Are you a tight ass? Treatment you need.
Oh, who needs to sit cross-legged anyway? Oh, that's not good.
Let's wait for that to release.
Oh,
Yeah, beautiful.
oh, there it is. Gone, done, I reckon. Nah,
Couple more.
that's good.
Still pushing really deep in there. Elbows deep into the glute, but through into the piriformis, the obturatus externus, internus. Beautiful. And sink out.
Oh, what a treatment.
Awesome.
Probably the best one yet.
There it is, guys.
Oh.
You got a tight ass. You need to get treatment by one of us here at MMT. If you do have lower back pain, hamstrings that aren't firing well, inability to bring your knee up to your chest, you can't sit cross-legged, whatever it is, get in, get some treatment, work on your glutes, and you'll feel way better.
Thank you.